This facility is known for training fighters. It's a perfect example. The fighter, everything they do is internal. Everything they do is in here with kicks and punches, and there's an overuse pattern. So at a certain point in their training regimen, they need to correct that, to work on that, so that they can execute those movements better next time or when they start their season again. So there's many factors, whether you're recreational or you're competitive, that require you to focus on establishing a good posture, both neurologically and biomechanically.
Final point I want to make up is many of you have heard about this concept of inflammation, how we tend to walk around chronically inflamed, and how inflammation is bad for most of the tissues in our body, the cells in our body, and I can tell you inflammation shortens telomeres. So when you have hypoxic muscles that are not getting enough oxygen, their response is going to be an inflammatory response. They're going to generate certain acids and free radicals in the body based on that. And that's going to contribute to this inflammatory milieu, if you will, that's in your body. And so this is another component of inflammation people don't talk about. They talk about diet, diet, diet. We want an anti-inflammatory diet. And that's absolutely true. But the things that I've brought out to folks in the Telomere series and lecture series that I've done is that there are other sources. And this is a more subtle source, but it's there. There's no question about it. And then just as a reminder, those of you who have caught some of my lectures on aging, understand that aging itself is an inflammatory process. So this postural management will help you move through life with muscular balance, with neurologic balance, and those of you who embrace the concept of a balanced mind leads to a balanced body will understand where that's going. And it will also help you reduce the fatigue and the inflammation in your body. So Ben, I want to thank you first of all for your incredible expertise that's about to be demonstrated here. And you at home, you're in for a real treat. Pay close attention. We've made this as simple as we can. We've picked the stuff that's most likely to help everybody at home, because almost everybody at home has these problems or some part of them. And once again, you have a great day. Thanks for being here.
Thank you so much. Audience, what we want to do now is sometimes it's better to visualize what we mean by good and bad posture. And what we're going to just do is, before you see the actual self-assessment, we want to give an example of what we mean by good and bad mechanical posture, what it should look like, what you're going to see the two extremes. So Dr. Dave is our volunteer here. The three general areas that you're going to be looking at, you're going to start looking at your feet. So generally, pretty decent posture. When you look at the feet, they'll be parallel when you stand relaxed. So they'll be in the same direction as they are. You're going to be slightly externally rotated out, which means your foot's going to be out slightly. That's acceptable. And you're not really going to see more of the inside of your ankle, versus the outside of your ankle. Okay? So what I'm going to do is correct Dr. Dave so that he's in a better foot and ankle position. I'm going to ask you to push on the outside of your foot more, please. Not slide your foot, just push on the outside. Perfect. Do the same here, please. A little more here. Good. Very good. Okay. So if you notice, I have the same distance here and here. Okay. Now I'm going to exaggerate. Dr. Dave, just stand relaxed, please. Normal like you would. I want you to externally rotate this out because this is the side we have problems with. And I want you to pronate this a little bit more. So the other way. Perfect. Okay. That's an exaggerated posture at the foot, but that's 75% of the population. You'll see that quite a bit, usually on one side more than the next. So again, show me the correction so when it's good posture. Good. You see the same amount of ankle on either side, and the feet are more or less parallel. Okay. Second place you're going to look is going to be using the pelvis. We're going to use the hands as a guideline. Okay. And what you're going to do, Dr. Dave, is raise your chest, please. Good. And that's not bad. They're more or less even. Now what I'm going to show you is exaggerate bad. I want you to drop your right shoulder, please. Good. And I want you to internally rotate this. Good. In many cases, this is an exaggeration, but you'll see that internal rotation of the shoulder and dropping of the shoulder. And that is very, very common in athletes that are one-sided sports or where there's a severe problem at the pelvis. You'll see that lateral flexion. We're going to correct it, raise the chest, and perfectly correct would be raise your chest more, squeeze the shoulder blades together, and that's where they should be. That's perfect. Okay? Relax, Dr. Dave. Okay? The third you're going to face that way, please. Okay? Okay? Now again, you want to have the same line between the ear, the medial delt, the hip, and the medial portion of the ankle here. So I'm going to correct that for Dr. Dave so it's perfect. Tuck your chin, please. Not down, but in. Perfect. Good. Squeeze your glutes, please. Good. Push on the outside of your feet, please. Very good. Okay. So we got a decent line here. Tuck your chin a little more, please. That's where you want to be. So we have a nice straight line from here, 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 and here. Okay? It's difficult for him because he has a better forward neck posture naturally. Take a deep breath and relax into your normal posture. Relax. Good. Okay? So you can see already the ear went forward of the shoulders and the shoulders went forward of the hips. This is an exaggeration. This is what you'll see. In most of the population, about 75%, shoot your chin a little more. Not your head. Yeah, there you go. Perfect. Good. Pronate both feet. Too much, just a little bit. That's what you'll see generally in about 75% of the population. You're going to see that forward neck posture. So that's forward of the shoulders are forward of the hips. You lose that nice straight line. Let's correct it again. Once more. Boom. Boom. Squeeze your glutes, please. Supinate your feet a little bit. Press on the outside of the foot. Squeeze your glutes a little bit more. Tuck your chin. More. Chest up. Good. See, it's uncomfortable for Dr. Dave. Fire your abs. So it's a nice straight line from here, here, here. But you feel lighter in that position. Am I correct?
Definitely.
Okay? Go to your normal posture. You feel heavier in that position.
Definitely.
Okay, so we have a 20-year-old fighter, Rio, and Rio is going to be showing us what a self-assessment will look like for the phase 1 biomechanical postural realignment workout for Telomere longevity series. Rio, stand by your sides, hand by your sides, feet at shoulder width, please. Good, just stand relaxed. Good. Actually, before you start, I'd like you just to march in place. Just march in place. Good. Knees a little bit higher. Good. Look straight ahead and stop and stand naturally. Good. Okay. So what we did was basically just realign, and he's going to go into what his natural stance is. So Rio, you look down, and what do you see when you see your feet?
Pointed out a little bit at an angle.
Okay. Put that in your pocket. Both feet are pointed out. Okay. What do you see when you see the second position, which is your both your hands? Do they look even?
Yeah.
Yes, I would agree. When you look at your pelvis in relation to your belly button, or your belly button in relation to your pelvis, okay, Rio would be looking in a mirror instead of the camera. So I would agree, it looks pretty balanced. When you look for a male at nipple height, he'd be looking in the mirror. What I see is your left nipple is a little bit lower than your right, which indicates a little bit of lateral flexion. So I put that in my pocket. So far, I have external rotation on both feet and ankles and a little bit of lateral flexion. He's going to look at his clavicle in the mirror, and you're looking at the height, one side relative to the next, and it looks actually pretty good. And then he's going to look at his position of his shoulders with relation to each other and his neck. And again, it looks like the left shoulder is slightly lower than the right. So I have 3 points in the first static exam. I have external rotation at both. I have the left nipples a little lower and the left shoulder. I put that in my pocket. Rio's going to sit on the chair. The second static exam, palms up on your lap. He's going to be looking straight ahead in the mirror. And now it eliminates the pelvis from the situation. So I look at the nipple height and I still see that the left is a little lower than the right. So it indicates that whatever the imbalance is in the torso is not coming from the pelvis, it's coming from the upper body. I look at the neck in relation to the shoulders, and it actually looks better than standing. It looks more even now, and the neck looks pretty straight. I'm going to look at it from this angle. Actually has a little lateral flexion to his right. So the neck is just a little laterally flexed to the right. Okay? So of the two static exams, we've got external rotation at both, a little lateral flexion to the left, and a little bit of lateral flexion to the right on the cervical spine. Now, the second part of the static exam, he's standing. So he's standing, he's going to be now looking towards the mirror over his right shoulder. What you're looking for, or what Rio would be looking for, is the position of his ear with relation to the middle of the shoulder, with relation to the hip, and this middle bone of the foot here, which is the malleolus. We're looking for alignment. So if you look straight ahead, Rio, look straight ahead, please. You'll notice that the ear is slightly forward, the shoulders are slightly forward, which indicate a slight forward neck posture. The hips are pretty aligned with the shoulders, and the middle of the foot is slightly back, which means that the hips are forward and the shoulders are forward. So we're looking at a slight bit of kyphosis and a slight bit of forward neck posture, and he's compensating by having his hips back. Okay? So now we're going to do the first dynamic test. So Rio's going to face the camera. Okay? You're going to make sure you're near a wall. Today I'm the wall, so he knows that the wall is there if he needs the wall for balance. You're going to have your hands relaxed, and you're going to raise all your toes on your feet. Very good. Now you're going to close your eyes with your toes up, and you're going to keep your eyes closed and put your toes down, please, and open your eyes. What you're looking for is whatever sensation you felt. Were you neutral? Did you feel like you went backwards, or did you feel like you went forwards? So how did you manage your center of gravity or your center of balance when you removed the eyes? What did you feel?
Forward.
Slightly forward, okay? That's what I saw, just a slight bit forward. Very, very subtle, which means that, again, that matches that forward neck posture and that forward kyphosis, or rolling of the shoulders forward. Being a fighter, this is normal because all the punches are internal. So he's not really doing anything back here. So it's a normal compensation. In his case, it's very, very, very slight. In most of the population, it's a lot more pronounced than that. You'll feel a forward sensation like you're going forward. The second dynamic test is going to be a squat. Rio's going to put his hands out in front. The hips just out, the feet just outside the hips. You're going to look straight ahead. What you're looking for is the ease at which you get into a full squat, how straight your torso is with relation to your pelvis, and how deep you can go. And again, does it feel like it's easy to get into a full squat? Does it feel like it's really difficult? Do you feel like you're losing your balance? It's just a general dynamic test. So you're going to squat nice and slow. And back. Good. One more, as deep as you can go. Very good. That was very, very good. So in terms of how he dynamically utilizes his posture and manages his center of gravity, it's very, very good. For that anterior scapular plane, it doesn't show in his squat at all. His squat is actually very good. It could have been a little bit deeper, but that could be just tight from sport.